Is it true that Republicans plan to gut Medicaid funding, then blame the states when people lose health care? Overview of Republican plans for Medicaid in 2005. Recent budget resolutions advanced by congressional Republicans set the stage for significant cuts to Medicaid funding. While the specifics are still being negotiated between the House and Senate, the framework directs committees to find up to $880 billion in savings over 10 years, with Medicaid identified as the most likely target for these reductions. This is because other major programs like Medicare have been declared off limits for cuts, and there is not enough spending elsewhere under the relevant committee's jurisdiction to meet the savings goals without reducing Medicaid funding. Mechanisms of proposed cuts. Primary mechanisms under consideration include reducing the enhanced federal match rate for Medicaid expansion states. This would shift a greater share of Medicaid costs from the federal government to the states. Slashing provider taxes. These are taxes states levy on healthcare providers to help finance their Medicaid programs, which could be capped or eliminated to save federal dollars. General reductions in federal Medicaid funding. The scale of proposed cuts would likely force states to either reduce eligibility, cut back payments to providers. Potential impact on states and Medicaid recipients. Because Medicaid is a joint federal-state program, any reduction in federal funding puts states in a difficult position. States would have to either increase their own spending to maintain current coverage and benefits which most state budgets cannot absorb, or reduce the number of people covered, cut benefits, or lower provider payments, which would likely result in millions losing health coverage. Advocates and analysts note that if the federal government reduces its share, states will be forced to make the hard choices and bear the political fallout for people losing coverage or services. As one policy expert summarized, you might reduce state funding by some gigantic number, and then the state has to react to that, and we can't tell you exactly what they're going to do. Will Republicans blame the states? There is evidence that the Republican strategy involves shifting responsibility to the states. By reducing the federal match rate or overall funding, states are left to decide how to manage the shortfall. Some Republican lawmakers have publicly stated that this approach would leave it up to states to determine how to handle the reduced funding, effectively making governors and state legislatures the face of any resulting coverage losses. This dynamic has been explicitly acknowledged by both Republican and Democratic officials and is being highlighted by advocacy groups and news outlets. Conclusion: it is accurate to say that current Republican budget plans would significantly reduce federal Medicaid funding, likely forcing states to make cuts that could result in millions losing health coverage. The structure of these proposals does shift the burden to states, and there is evidence that Republicans are prepared to blame state governments for any resulting loss of coverage, even though the cuts originate at the federal level. The details of how this will play out depend on ongoing negotiations and the specific policies that are ultimately enacted.